2-year-old boy has died after contracting E. coli at the San Diego County Fair.
According to the county's Health and Human Services Agency, he was hospitalized and died on Monday. Health officials are investigating 4 infections in children ranging in age from 2 to 13. The children visited the fair between June 8th and the 15th. Although the source of the bacteria has not been officially determined, all 4 children had reported visiting the petting zoo or came into contact with the animals.
Fair officials have closed public access to the areas, and here to talk about the outbreak and how you can avoid contracting E. coli is Dr. Melanie Palm. Good morning. Obviously, very scary. We were just talking about you have gone to the fair. I've gone to the fair. Jason, I mean, you've gone in years past.
Many times.
Taken your granddaughter, taken kids. Yeah. And so that's why this is scary, because everybody in San Diego, a lot of us have gone and go to that petting zoo area. So what do you know about this? And when you're saying the 4 kids and when they contracted this, obviously that would conclude that there's probably not going to be other people who come out about this.
Yeah, so I actually took my staff there on Wednesday and we went to the petting zoo, and I will say they were excellent about hygienic control, and we'll talk about the spread of E. coli and how this actually infection occurs. But they were really, there was a person at the exit gate telling every single individual to wash their hands. So I think they're very mindful of that. You know, E. coli infection, it's what causes urinary tract infection. It's what causes traveler's diarrhea when we go to Mexico. But there's about 6 strains that can cause real problems, and probably the one that this was a Shiga toxin related one. So it creates this toxin and it actually invades the tummy. So we typically get it through foodborne illness or water, which is why restaurants are under such tight control and why we're always told to wash our hands after using the restroom. But also zoo animals, petting animals, they also are sort of a known source. Daycare centers are sometimes a source too. And what happens is we touch something that has a little bit of the E. coli. E. coli is something that's in our lower gut, so it's kind of a dirty bacteria. And then it's not meant to be in our upper gut. So we touch something and then we touch our face, or, you know, kids are probably licking their fingers and they get a minute amount. And if you get this right substrain, which the Shiga toxin can cause a bloody diarrhea in about 80% of patients, it causes gut swelling, you can get vomiting, you don't feel well, you've got a fever. It's something you want to see the ER right away if you're having any sort of bloody diarrhea. It was something in the 1950s when we identified this was almost universally fatal. We didn't know how to support patients with this. Now it's an extremely low mortality rate. That's why I think it's newsworthy, is typically this isn't something that's fatal. Most patients recover, but extremes of age, being very young, being very old, or having somebody that has an underlying immunodeficiency, if you're somebody undergoing chemotherapy or you had some sort of just innate problem with your immune system, you're a little bit more likely to contract these things. But in the hospital, we do some really neat things. You know, I see just skin infections with E. coli. I'm not addressing this like they probably are at the big children's hospitals. But it's supportive therapy for the most part. Even though this is a bacterial infection, we typically don't give antibiotics for it. It's IV fluids, it's running lab tests. One of the most common complications that causes mortality is something called hemolytic uremic syndrome, where you actually get kidney failure. And it only happens in about 5 to 15% of this Shiga toxin, this really unusual one that's caused the problem in these 4 children. But it's a real problem because kids are very vulnerable to it. It sometimes requires hemodialysis. There's actually a new biologic medication that's a complement inhibitor called Soliris that's sometimes used, but some pediatric nephrologists actually think putting people on antibiotics can sometimes worsen this hemolytic uremic syndrome. So it's really a watch, wait, support, and be in a hospital setting and get the proper treatment.
It's just amazing because every time we talk about E. coli, it's foodborne, and you were talking about this earlier. Who would have thought that you go to a petting zoo, something as innocent as that, and it can be anywhere, I guess.
Seems so rare.
I know. Well, you know, the E. coli is in our colon, right? And so when we end up eliminating from our colon, sometimes animals are not as clean as we'd hope, and then sometimes people don't wash their hands afterwards. So it could be a situation somebody touched a farm animal. It could be something where there was E. coli actually in the gut of one of these animals. And I'm sure that they're actually trying to track what this is, because this becomes a problem. We want to identify everybody that may have been affected. You know, the petting zoo has been shut down, but like I said, they were very careful when I was was there just this week about really being mindful, having people wash their hands, knowing that this is a risk.
Okay, so that's the number one thing that you can do. Obviously, they've shut down this area at the fair, but just for people in general, make sure that you're washing your hands. That's the number one preventative thing you can do.
Yeah, wash your hands. Hygiene, you know, carry one of those little hand sanitizers. That works great too if you don't have the ability to wash hands afterwards. But that goes true with food, water, zoo animals, pet animals. You just want to make sure after you're doing that, before you're eating, before you're touching your face, you know, that you're actually protecting yourself and have good hygienic sort of manners.
All right, Dr. Melanie Palm, thank you so much for your time this morning. We really appreciate it.
No problem.